How do you deal with interoceptive sensitivity, meaning that you're either over or under sensitive to internal body stimuli? My name is Dr. Ruth Dutton. I'm a board certified adult psychiatrist, and I recently did a video about the different sensory sensitivities. And when it came to interoception, I had so many people commenting that they have both or that they have one really strongly and that they're not sure how to cope with it. So I wanted to do a couple of videos on how you can actually manage these sensory sensitivities. And they don't have to be a detriment to your life. They can actually be a positive, but it is important to manage them in certain situations. So first, let's talk about over receptivity, meaning that you are overly sensitive to your internal body stimuli. This is people who can feel their heart beating in every part of their body, or they can feel the contents of their stomach moving through their gastrointestinal system. Now, for some individuals, these symptoms don't bother them at all, but for others, it can cause a lot of anxiety, a lot of concern that maybe there's something wrong with them, that these sensations that they're experiencing are not normal. So in general, I recommend working with a mental health provider, either a therapist or an occupational therapist. But of course, some of these things you can do on your own if that's not accessible to you. So first, the kind of gold standard to this is going to be interoceptive exposure, which is where you expose yourself to the different sensations, starting out with small exposures and gradually building and building to those that are very uncomfortable for you, essentially to show your body that they're not dangerous and to desensitize you to the anxiety and panic that they can cause. Now, this is one I do recommend working with a therapist on because, of course, depending on the situation and what you're doing, it could potentially be dangerous. Of course, there are also CBT strategies that can be helpful as well, and working on mindfulness. So when you're having these heightened sensations, do some deep breathing, do a body scan, go on a mindful walk, do some mindful coloring, and that can help you to cope with them. Okay, so that's over receptivity, but let's talk about under receptivity, meaning that you are not sensitive to your internal body cues. So these are those people who totally forget to eat or drink all day until they are like, I feel terrible. What's wrong with me? Or people who have a really high pain threshold because they're literally just not aware that their body is experiencing it. So there's kind of two categories for this one. The first one is going to be interoception awareness building. So this can include things like having a feelings journal where you document what exactly you're feeling in your body and any associated emotions that you might be experiencing at the same time. And this can help you to be more aware of those sensations as well as to link them to any correlating emotions. And of course, here, mindfulness is also going to play a key role on this side of the spectrum. So doing things like mindful eating, breath exercises, progressive muscle relaxation, mindful walking, body scans, and mindful temperature exposures can all help to increase your awareness of the sensations that you're feeling. The other intervention is going to be using adaptations or environmental supports to help you to be able to manage your lack of sensitivity. So timers can be a really helpful tool here. Maybe you want to set an alarm on your phone for regular bathroom breaks. It can also be helpful to implement a good routine that's highly structured with regular eating times throughout the day, as well as a regular bedtime routine. Other environmental supports could be using something like a smartwatch to track your heart rate, or looking at your weather app before getting dressed to go outside because you might not be aware of whether or not it's cold or hot, or having a water bottle that's marked with your hourly water intake goals. So these are just a few of the different ways that you can manage your sensory sensitivity to interoception. But if you guys have other things that have been really helpful for you, please share in the comments below. I'd love to hear about them. Wishing you all good mental health today, and I'll see you in the next one.